Instead of letting consumers control their healthcare dollars and control their healthcare decisions, we've got a centralized economic planner, the federal government or state governments, that are making these decisions for people, and they're making worse decisions. And that is costing lives, it's costing money. And if the government would just stop trying to regulate drugs, regulate medical facilities, regulate clinicians and what clinician categories can exist and what services that they can provide and so forth. If the government would just play that background role of enforcing contracts and punishing clinicians who hurt people through negligence, or drug companies who offer faulty products through the tort system, then we would have an explosion of innovation that drives down the cost of healthcare, drives down prices while improving quality. My name is Michael Cannon. I'm the Director of Health Policy Studies at the Cato Institute. So the government should play a role in healthcare. We want the government to enforce contracts that we make with our doctors so that they will keep their promises to us. If a doctor injures us through negligence, we can go to the courts and force the doctor to make us whole again. The threat of liability discourages them from providing low-quality care that might hurt people. So both of these things make us more free. There are different gradations of what government can do, and the most important thing government can do is not get in the way. There's really never been a time when we've had both modern medicine and a free market in healthcare, because around the same time, medicine really began making advances in the early part of the 20th century. That's when government began playing a very extensive role in healthcare. Everybody presumes that in the United States, we have a free market in healthcare where everybody gets to make their own healthcare choices, and that's why we have such high prices and such high spending levels. In the United States, we spend about $5 trillion a year on healthcare. Half of that the government controls directly by taxing it from us and then spending that money on healthcare. Another 35% of it is private health spending that the government compels us to spend on employer-sponsored insurance. So when you add all of that up, government controls 85% of the health spending. It is within striking distance of Cuba, a communist nation, where the government controls 90% of health spending. The worst thing that the federal government does in healthcare, or has ever done in healthcare, was to create an income tax. Congress created the second federal income tax in 1913, a time when health insurance didn't even exist, so they didn't even give it a thought. But when employers started offering health benefits to their workers, some government bureaucrats said, you know what, we're not going to tax those health benefits as income. We're not going to subject them to this new income tax. And as a result, over the decades, what that meant was if your employer gave you $1 of cash income, it would be subject to that income tax. But if your employer gave you that same dollar as health insurance instead, it would be tax-free. And so you can see how this creates an implicit penalty on taking that dollar as cash and making your own health insurance decisions. This distortion that the tax code created is responsible for almost every problem that Congress has been trying to solve ever since. High prices for healthcare, high prices for health insurance, low quality healthcare, low quality health insurance, the huge problem of pre-existing conditions that we had in this country that Congress has created entitlement after entitlement to try to solve, and then just congressional inertia, letting that problem just fester and fester over time. As for why does healthcare spending in the United States keep growing almost uncontrollably, it's because unlike other countries, when the government has gotten involved in healthcare in the United States, it doesn't set a budget for health spending. To the doctors and hospitals, insurance companies, whoever participates, you know what, whatever bills you send us, we'll basically just pay. And that is a recipe for just rising prices and rising spending. Government healthcare spending is the main force driving the federal government toward a debt crisis that will bring rampant inflation, economic recession, and wrenching cuts to federal spending, including federal health programs. So Congress may feel like we're providing healthcare to people and we have to keep providing healthcare to people. We can't possibly cut healthcare. But in reality, Congress has to cut healthcare. Patients in the United States have a very hard time finding out what's the price going to be for this doctor's visit, for this surgery, or what have you. And the reason is that the patients aren't the ones controlling the money. If you're paying with someone else's money, you're going to care about price information a lot less than if you're spending your own money. So in general, patients don't demand that information. And then if the most profitable route is still not to provide it to them, because keeping those prices hidden allows them to get higher prices out of insurance companies than if they made those prices public. The best way to guarantee transparent prices that are accessible to patients, that patients can understand and use, is to let the patient control the money. And the prices would be lower if the government just backed away and said, all right, we're not going to try to manage this sector of the economy anymore. The idea that people will not take care of themselves and then will need medical care and they won't be able to afford it hurts my heart just like it hurts your heart. But they have a right to spend their money the way they want. Just like you have a right to choose whether or not you're going to help them. It's not okay for you to take away their right to make those choices for themselves. It's not okay for you to take away my right to choose whether or not to help them. And if we respect both of those rights, fewer people will end up in that situation because healthcare will become more affordable, health insurance will become more affordable, more people will buy it, fewer people will end up without access to the care that they need. And while there might be some people who still can't access the care that they need, that will be a much smaller number of people than who are suffering right now from the fact that government has taken away all of those rights from us and left us with lower quality, higher cost healthcare.